I'm a surgeon. I love operating. Even though I've been doing it for over 20 years, I still find the thought of doing hip replacement surgery incredibly exciting. So you can imagine for surgeons like me, the lockdowns have been terribly frustrating. But next week we're starting again and I can't wait. But what about you, patiently waiting for the call to come in for your hip replacement surgery? The misery of hip pain and how it affects all aspects of your life is a terrible burden. The COVID pandemic has caused the NHS waiting list to grow out of control. And as far as I can tell, there doesn't seem to be a coherent plan to deal with the huge numbers of people waiting for a diagnosis and treatment. Some of you might have private health insurance or the means to pay for your treatment. For everybody else, the NHS will eventually do what's necessary, but it could be a long wait. I thought it might be helpful to explain to you how the system works, so that you have the information that you need to navigate your way through it. If you've got a painful hip, the first thing that most people do is go and see their GP. The GP will make the diagnosis. You'll be given advice about things like exercises, painkillers, weight management. If these don't work, then after a few months you'll be referred to what's called intermediate care. Here you'll see a physiotherapist or another GP. They reassess your symptoms and discuss with you the next steps, which might be referral to an orthopaedic surgeon. Given the waiting times in some areas, it might be a year or two before you get seen by the surgeon and have your operation. How can I help you? Well, some people come and see me to have a second opinion. They want to know more about the diagnosis, what the options are for treatment, and what might happen to them if they have to wait for ages for their surgery. Knowing these things can be incredibly reassuring and helps you to put things in perspective and to make plans. The more information that you have, the more informed you are, and that's really important when it comes to your health. Private treatment is of course expensive, but you'd be surprised to know that lots of people choose to have a private opinion and then they continue on the NHS pathway. I really hope this has been helpful. If you'd like to know more, then call Anne and Tracy in the office or email me. Have a look at my website where you'll be able to download a copy of my information booklet, Living with a New Hip Joint. Thanks for watching. I'm Jeremy Latham and I'm the hip surgeon.